I originally got involved in medicine. I was a biology major, secondary education, so I'm supposed to be a high school teacher, biology teacher, and I realized I wasn't mature enough to stay in school. I then went on to medical school at the advice of an advisor, and was very concerned my first couple of years, and then fell in love with it afterwards. I'm Joe Funk. I've been with Orlando Orthopedic Center 13, 14 years now. I came here right after residency. I originally was born and grew up through about 6th grade in Coffeyville, Kansas, on the border of Kansas and Oklahoma. Great place to grow up, not a great place to grow old. From there, my family moved to the Denver metro area, went through high school there, on to Idaho State University. I actually played football at Idaho State for 5 years, redshirt, and then for 4. Got my degree, went on to Iowa for school, and then down here for residency in Orlando. Worked with some of the guys here at Orlando Orthopedic Center, and offered me a position that I couldn't refuse, and here I am. I'm very blessed as far as my family. I have a wonderful wife. We've been dating since she was a freshman. I was a sophomore in high school. Went and got married after college. We have 3 kids. Right now they're 13, 15, 17, and it's just a great time watching them grow up and play sports, and a little nervous about them going off to college. As far as hobbies, probably my biggest passion is fly fishing. Unfortunately, I don't do a lot here. I would prefer to be small river fly fishing. It's probably been 10, 12, maybe 15 years since I've caught a trout on something other than a rod that I've built and or a fly that I've tied. With that said, here in Orlando, it's a golf mecca, and I have a passion for golf. Most of my weekends, however, are spent watching my kids play their various sports. As far as my job, I have a wonderful opportunity to not only provide primary care for the lower extremity, the foot and ankle, but also surgical options. It gives me a broad spectrum capability, whereas some folks consider themselves maybe only surgeons and they're not interested in other things. I get to develop relationships with my patients. I really enjoy that. I get to know them. Preferably, however, it's nice to see them, figure out what's going on, give them the fix so they don't have to come back. But primary care of the lower extremity, surgery of the lower extremity, I really enjoy what I do. I'm very fortunate to be involved with Orlando Orthopedic Center. As I said prior, I came here right after residency. We have 15 some plus surgeons now in the group. We have 2 to 3 surgeons for every body part. We all relatively stay within our specialty. So when that patient walks in the door, whether they're seeing me for the lower extremity or any one of my partners, they're getting board certified care for what they need and what they do. That gives me comfort doing what I do, because I know I can focus on mine, and then if there's a specialty above and beyond what I do, knee, shoulder, etc., I have a competent and personable partner that I can feel comfortable sending that patient to. There are a handful of things that I see repetitively on a daily basis, one of which is plantar fasciitis. That's the inferior heel condition. Multiple patients a day. Ankle sprains would be a very common condition. And then obviously the classic lower extremity things. It's the bunions and the hammer toes and the deformities. As far as treatment options, again, most of the things that we deal with are successfully treated conservatively. However, there are some deformity issues that need to be addressed surgically. When patients come to see me for their lower extremity condition, I hope the first thing they see is a smiling, welcoming face of my assistant. When they come into the room, I hope that I'm personable with them. I do my best. I try to listen. I try to pay attention to what the need is. Obviously, the most important thing is addressing the pathology, diagnosing appropriately, dispensing a good, effective treatment for that condition. And then when the patient leaves my office, while sometimes I don't make every patient happy, sometimes shots hurt or the information maybe not be great, hopefully on the way out of the office they see a smiling, welcoming face, and when they leave they know they have a place to come back to, whether it be for my specialty or any of my partners.